Hello, I'm Dr. Vivien Brown. I'm a past president of the Federation of Medical Women of Canada. I'm a family doctor in Toronto, an assistant professor at the University of Toronto, and I have the honor to represent the College of Family Physicians sitting on the board of Immunize Canada. For those of you that aren't familiar, Immunize Canada is all about promoting immunization supported by Public Health Canada, and the College of Family Physicians obviously supports immunization. What I'm going to talk about today is some details about COVID vaccine and the specific information that's important for women, because there are some gender issues around vaccination, and I wanted to give you the basics and then go into some of the issues for women. In terms of disclosures, I have the honor to speak for just about everybody that has anything to do with immunization. So I'm going to talk about the importance of continuing to immunize routine immunizations during the pandemic, understand NACI's guidelines, NACI being the National Advisory Committee on Immunization. That's who gives us our information and guidelines about timing during COVID vaccinations and how to effectively implement these recommendations into your clinical practice, what you should pay attention to, what's really important for all doctors, not just for family doctors and not just for immunizers. Everybody needs to understand some of the issues. Well, what NACI has said is that when there's a disruption of services, even for a short time, what happens is we end up with susceptible individuals for vaccine preventable diseases. And so even when COVID eventually is less of significance and international borders are reopened, there's individuals who may have missed their routine immunizations, things like pneumonia, shingles vaccine. These are important, and it may be very difficult to catch up. We also know that older adults are particularly susceptible, and we can offer immunization and combine it with other medical visits. And it's very interesting that even vaccines that are multiple dose vaccines, like Shingrix, for example, for shingles, we can defer the second dose if we need to. So we have a little bit of flexibility, but we need to be cognizant of the fact that we need to pay attention, that we can't just let routine care wait till COVID finishes because it'll be too late. So let's look at the COVID vaccines for a moment and understand how they work. The COVID vaccine basically stimulates certain antigens, which triggers an immune response. And by injecting these antigens into the body, our immune system responds by recognizing the antigens, producing antibodies to fight the antigens, and remembering this for the future. That's typical for all vaccines. What we know is that some vaccines have adjuvants, which are additives to boost the response. And we know that vaccines may contain small amounts of antibiotics to prevent contamination during the manufacturing process. And there may be preservatives and stabilizers to keep the vaccine stable and effective when it's being made, shipped, and stored. So what we can say to our patients is don't think of it as a shot or a flu shot. Think of it as installing virus protection software. You know, we want to use language that patients understand, and everybody understands computer language better than they understand medical language. So this is all about virus protection software. Well, let's look at the mRNA vaccines because the trials came out, the vaccines have been approved, and what we know is that these vaccines have exceptional efficacy. They have very mild to moderate side effects, and they're very specific to the COVID virus. What we can think and what we know in terms of how the vaccines work is it is a messenger RNA vaccine. It's used synthetically, producing genetic material, which then encodes instructions to the cell to produce the spike protein. That spike protein is then recognized by our antibodies, and thus we produce antibodies. The way I explain this to patients is the mRNA is giving the cell a recipe. The cell then follows this recipe, produces the spike protein, and we end up with antibodies recognizing the spike protein. So it's not altering the cell, it's not DNA, it's not using a live virus, it's a very safe vaccine basically telling the cell what to do. And I think that analogy works very well because people understand when you follow a recipe, you then make something. Well, the mRNA vaccine is the recipe that we're now going to follow. So it's not a live virus vaccine. It can't cause infection. It has no effect on host DNA because it never enters the nucleus of the cell. And all of that is reassuring to some of our patients that have a lot of misinformation about mRNA vaccines. They've been rigorously evaluated, approved by multiple health agencies all over the world. Very few side effects, and usually the side effects in the clinical trials are what you would expect. High efficacy after 14 days, about 82%, and at 21 days or 28 days, about 95%. I will show you the side effects, and they include fatigue, muscle pain, chills, fever. I tell people they may not feel well for a day or two, but that's acceptable. An uncommon side effect is enlarged lymph nodes. That may be important when you're doing a mammogram, and I'm going to come to that in a few minutes. So NACI says at this time that COVID vaccines should not be given simultaneously with other vaccines. And the reason for this is because we don't have enough information to really recognize which side effects may be from one vaccine and which from another. Interestingly, the FDA has now said you can co-administer COVID vaccines with other vaccines. And the BC Health Authority has said, yes, you can co-administer. But generally in Canada, the major NACI guideline says not to co-administer, to wait 28 days after an mRNA vaccine, and to wait 14 days before giving another vaccine before administering the COVID vaccine. This is what it looks like. 14 days before is the interval before you give COVID, 28 days after before you give anything else. If you're giving a second COVID vaccine, you can use something in that middle time before you give the next vaccine. And this is the information on BC that is doing things a little bit differently. This change in recommendation is following the ACIP guideline. ACIP is the American US Advisory Committee on Immunization Practice. And here's NACI's schedule. I think we're all familiar with this. Both Pfizer and Moderna have a 2-dose schedule. NACI then said, but if you can't do it according to schedule, you can wait longer, but there's no data on the maximum interval. And so we're trying to keep to that 2-dose schedule of 21 to 28 days. Given supply, a lot of this was longer. And at the same time, we need to do what's practical in this country. So in Quebec, they waited as long as 90 days. Various provinces did different things. And this was considered exceptional circumstances based on the availability of the vaccine. Right now, and I'm talking September 2021, there is vaccine throughout the country. Generally, things are being scheduled closer to that 21 to 28 day interval. The company line, both Pfizer and Moderna, said what was studied was the shorter interval, and that a longer interval, there's no data in terms of how efficacious it is and how long that first dose alone is sustained. In terms of the viral vector vaccines, both AstraZeneca and Johnson & Johnson, they're using a different technology similar to the common cold virus that is manipulated and attaches the spike protein. So they're using a completely different mechanism. J&J was approved in Canada, but never came to Canada because of supply issues. AstraZeneca was used a lot this spring throughout the country. It's not being used at this particular time. What did NACI say if you've received an AstraZeneca vaccine? There was talk about vaccine-induced prothrombic immune thrombocytopenia, which basically is that rare event of activated platelets causing thrombocytopenia, causing blood clots, about 1 per million with the AstraZeneca vaccine. This is what Thrombosis Canada said, a reminder that it's very rare with the AstraZeneca vaccine, much more common with birth control pills, common in the general population. And in a hospitalized patient with COVID, it was 147,000 per 1 million. So we need to understand and explain to patients what is a very rare risk compared to something that is rare or common or very common. I think what's important is that we need to let our patients know that AstraZeneca is now on hold. not because it's a bad vaccine. There were some issues around rare side effects, but we also have plenty of other vaccine, the mRNA vaccines right now. Will that be the same situation in the next year or two? We don't really know. And NACI was careful to say that Canadians who received AstraZeneca should not think they've received a substandard vaccine, and they are well protected against COVID. And this just gives you the Council of International Organization of Medical Sciences description of something that's very common, common, uncommon, rare, and very rare. And so these blood clots with the vaccine fell into the very rare box, which I think is reassuring. NACI went on to say that we can mix and match vaccines. Not every country is doing that, and there's not a lot of data around it. But the thinking was that you may actually get an improved response by mixing and matching vaccines. Now let's talk about some issues for women, some very particular issues. What about pregnant women? The SOGC, the Society of Obstetrics and Gynecologists of Canada, as well as the US governing body, stated very clearly that pregnant individuals should be offered vaccine at any time during the pregnancy or while breastfeeding, and any vaccine was acceptable. Similar to SARS, which happened in 2008, 2009, pregnant women are more at risk for COVID, they're more at risk for preterm delivery, and their baby is more at risk for harm from COVID than any theoretical risk from the vaccine. So we are encouraging pregnant women to get immunized as soon as possible, and all pregnant women are eligible to receive COVID vaccine. I mentioned lymphadenopathy, and I just want to remind you that the Society of Breast Imaging and in the US and Cancer Care Ontario have said routine mammograms should be held for 4 to 6 to 8 weeks after the second dose of a COVID vaccine, because there is a risk of lymphadenopathy, about 11.6% with Moderna and about 5% with placebo. Numbers were somewhere around 5% with Pfizer. But what happens is when you have lymphadenopathy on a mammogram, of course, the question is it associated with early breast cancer? Does it have to be reevaluated? Do we have to repeat the mammogram and expose the patient to more radiation? And it leaves you with a number of unknown issues. So very much a better approach, a much more logical approach is just not to do the mammogram at the same time as the COVID vaccine. I have seen this in practice. It leaves patients very wary and anxious until they get that repeat mammogram or repeat ultrasound. And it's so much simpler just not to do it unless there's some unusual urgency, I say, for 6 weeks after their dose of the vaccine. Now, there's other issues about reactogenicity for women. And by that, I mean the side effects of the vaccine. This is from a researcher named Dr. Sabra Klein at Johns Hopkins. And what she said and what her research shows is that in general, women have more side effects from vaccines than men. Although some of it may be due to a reporting bias, it seems that the side effects are actually genuine in terms of numbers. Headache, fatigue, dizziness is more common in women. Anaphylaxis, though very rare, is also seen more commonly in women. Biologically, women produce greater numbers of antibodies after flu shots, vaccines for measles, mumps, and rubella, as well as hepatitis A and B. And what's so interesting is boys and girls before puberty have similar responses to vaccine. But after puberty, with the impact of both genes and hormones, these immunologic differences start to be shown. And we see a different immune response to foreign and self-antigens and distinctions in innate and adaptive immune responses. And we know that women are more likely to have certain autoimmune diseases, certain susceptibility to infectious diseases, and responses to vaccines. So when I'm giving a couple in the practice a vaccine, a man and his partner, a woman, I'll say to the woman, you may have more side effects. It doesn't mean you have more of a response. It doesn't mean there's something wrong. Just in general, you may have greater reactogenicity than your partner. And I think it's reassuring to tell people ahead of time rather than some male partner says, what are you complaining about? I feel nothing. And a woman may have a very sore arm, fatigue, headache, whatever. So I think it's interesting, and Dr. Klein is doing some really interesting research around these numbers and this immunologic response. In terms of Menses, there's no clear relation or impact on the menstrual cycle, but it is being monitored because anecdotally, some women have reported changes. And in terms of surgery, infertility treatment or IVF, the advice is to hold the vaccine for 3 days before and 3 days after, so as not to confuse any issues with fevers, chills that may be post-procedure side effects as opposed to vaccine side effects. I think that makes sense for any elective surgery if possible. Now, what about blood clots? I told you the issue with AstraZeneca, and the other questions are, what about birth control pills and menopausal hormone therapy? And the answer is, even if she's had a previous DVT, even if she's had previous blood clots, she was not more at risk with the AstraZeneca vaccine, and that's because it was platelet mediated, not related to hormones in any way. I'm going to finish up by just mentioning that school programs have been halted across Canada in 2020 and 2021, and that's because school was halted. I think it's really important that we pay attention to the age group of who is being immunized in your province. In Ontario, it's generally kids in grade 7, but they may have missed that routine immunization. And depending on the province, different provinces are doing HPV vaccine, a quadrivalent meningitis vaccine, hepatitis vaccine at various ages. Using Ontario as the example, Ontario has 34 public health units, and the advice is different in different health units as to how to catch up with kids that have missed their school-based program. I think as primary care providers, we should take a look at our files, pull up the kids between age 12 and 14 if you're in Ontario, or whatever age group. In Quebec, they're doing HPV in grade 4. Well, it doesn't matter if there's no school, the kids aren't getting immunized. So I think we have to pay attention, look through these files and figure out who's slipped through the cracks, because we don't want a generation or a cohort to have missed vaccine that was available, that was being provided, and that is on hold for various reasons because public health is being overwhelmed. I have some other information on some standard vaccines, but I think I'm going to stop here. There's interesting information that we can put on the website, but I wanted a chance to talk to you primarily about COVID and the COVID vaccines and the issues for women. When in doubt, I think it's really important to remember how important it is to immunize. And I do think it's important for us to realize that immunization is what I would call a team sport. Sorry, I just want to bring up one more slide. What I was saying is that immunization is a team sport. We need everybody on the team to be practicing good medicine, to be talking about immunization, to be reassuring the public, no matter what we're seeing them for. We need to talk about vaccine. We need to get vaccinated ourselves. We need to make sure our staff is vaccinated. And we need to partner with the education system, with public health, with private insurance, with industry. We need to partner with everybody so that our public in Canada is vaccinated and we are preventing deaths from vaccine preventable disease. The latest information out of the US just said now, today being September 10th, that people who are not vaccinated for COVID have an 11-fold increased risk of serious disease, ICU admission, and death. So let's talk about it. Let's get on the bandwagon. Let's immunize ourselves, our families, the patients that we see, the people that work with us and for us. And let's make immunization a topic of conversation with every patient, with every visit on a daily basis. Thank you so much. I'll stop here.